Your Excellencies, distinguished delegates and partners, ladies and gentlemen, Assalamu alaikum. It is an honor to join you today at Vision Golfe 2025 among dynamic gathering of leaders, visionaries, and innovators. Let me begin by expressing my sincere appreciation to the Business France for organizing such an important forum here in Paris, a city that turns ideas into impact. Today, I don't think that we are simply here just to exchange insights, rather than we are contributing to shaping the blueprint for the new era of Gulf-French cooperation, one defined not only by ambition, but by shared purpose and tangible results. As we explore opportunities across healthcare, energy, innovation, mobility, transportation, and education, one truth becomes very clear. Health is not an outcome of one sector. It is the responsibility for all. Every policy, every partnership, and every choice we make. We live in a world where the demand on the healthcare system are accelerating, driven by aging population, chronic diseases, and increasing cost of care. In 2021 alone, global health spending reached nearly $10 trillion. This is more than 10% of the world's GDP. A figure is already high, and still rising, and should concern all of us. By 2027, medical costs are expected to grow 7 to 8% annually. If we continue on this path, we won't be spending more but solving less. These rising costs reflect a system that's built to treat illness rather than preventing it. That is something we can and must change together for the future of our beloved ones. In Saudi Arabia, we have made a clear strategic choice to look at health as not as a challenge to control, but as a value to protect and a foundation to build on. Under the Vision 2030, this transformation goes beyond the healthcare system. It is a whole-of-government commitment backed with governance, policies, and investment to integrate and embed health in all sectors. As a Secretary General of the Ministerial Committee of Health and All Policies, a national body chaired by His Excellency the Minister of Health, our mission extends beyond hospitals and clinics. It is about unlocking the health impact where it truly begins. In the decisions made in the education, environment, labor, transportation, planning, sport, investment, and others, which account for more than 80% of the factors that impact my health and your health. We bring these key sectors together under a unified agenda to improve population health and to reduce the preventable death and to increase not just life expectancy, but the healthy life expectancy. Examples of this collaborative approach, including updating the Saudi National Building Codes for healthier environment, also the comprehensive health screenings program in schools. These are not isolated efforts. They are coordinated multi-sectorial strategies designed to prevent diseases before it starts. Through policy reform and product reformulation and public awareness, we have reshaped both supply and demand. These initiatives have been recognized internationally as a model of the best practice. That's why Saudi Arabia now a home for the largest number of accredited healthy cities in the region. Our national health system is also undergoing a digital transformation at a unique scale. The Sahha Virtual Hospital, the largest of its kind globally, offers advanced telemedicine services. This represents not only a national imperative, but a global opportunity. France has long been a leader in public health innovation, biomedical research, and digital health solutions. And Saudi Arabia brings with it skills an integrated ecosystem, and a smart regulatory environment to embrace reform and innovation. We see a great opportunity for a co-investing in digital and AI-powered health solutions, also localizing the production of the pharmaceutical and health technologies, and exchanging expertise on smart regulation and system innovation. When we talk about scaling innovation, we mean more than new tools, products, or projects. We are talking about new ways of working together. Cross-government collaboration or public-private sector partnership and international cooperation are essential for us. This framework opens space for the private sector innovation, from healthier products, deploying digital health solutions, or investing in prevention-focused services. When policy creates the right condition, innovation will thrive and impact will multiply. The economic case is very clear. According to the OECD, if we invest $1 in prevention, we are saving $4 through lowering health costs and strong workforce productivity. And this is from the economic point of view, but also the public health evidence is equally strong. If we consider Finland's experience through multiple projects, they achieved 80% reduction in cardiovascular deaths over 40 years. 80% reduction in cardiovascular death is really a huge percentage, but not through construction of more hospitals or producing more products or solutions, but through implementing smart policies, healthier food environment, reducing smoking, and increasing physical activities. This example demonstrates a clear innovation drives progress, and prevention saves lives, and collaborations between us make it possible. The demographic change is not a distance challenge. It is already around the corner. By 2030, 1 in every 6 people on Earth will be aged 60 and above. If we take a moment now and you just ask yourself, how old will you be in 5 years? The more important question is, what will be your biological age in 5 years or in 10 years? By 2050, that number will be 2.1 billion. I'm one of them. So it's very important, and this matters to me and should matter for all of us. This question, or this leads us to a question, how well we will live, not how long we will live. Meeting such challenges require more than a clinical care and demand a holistic system that supports health in every dimension of our lives. Healthier environments, inclusive economy, resilient communities, and integrated governance. That's why Saudi Arabia is investing heavily in sustainability, health equity, data-driven governance, capacity building, collaborative policy making. So health is not in isolation, it is in integration. As France and GCC clearly expanding collaboration across healthcare, innovation, infrastructure, sport, and others, I invite everyone to ask one guiding question at every step. Does this promote health? And if it does, it will promote productivity, resilience, and sustainable growth. To our French partnership and to our GCC colleagues, Saudi Arabia is open for collaboration, whether through public-private partnership in digital health, or a joint research in AI-powered diagnostic, or expanding community-based and preventive care models. We welcome your expertise and partnership, and in return, we offer a market defined by scale, innovation, and long-term ambition to build healthier society, not for just today, but for generations to come. Ladies and gentlemen, let me leave you with this. As I promised, I won't stand long between you and your coffee. Saudi Arabia is not only transforming the health system, we are becoming one of the most exciting places in the world to invest in the future of health. Under the Vision 2030, we are building health sector driven by digital innovation and cross-sector partnership. And we offer, as you heard from my colleagues earlier, a rapidly growing population, digitally native workforce, a tech-savvy generation, and unwavering political commitment, all aligned to make the health investments capable and sustainable. So whether you are a policymaker, an innovator, or an investor, the opportunities are ready, and so is the kingdom. Thank you so much. Shukran.